Sometimes you see a silly thing and you're not really sure how to respond. Like when a transphobe pretends to be trans for like months and months. They're telling this doctor, oh, I have gender dysphoria. Oh, everything sucks. So y'all, I don't know if you know Moms for Liberty. It's a transphobic group of parents. Their chair faked gender dysphoria. So this is the actual article that was written by this woman who pretended to be trans in order to expose how easy it is to get access to this stuff. Oh, on September 6, 2022, I received mail from Kaiser Permanente reminding me of a routine cervical screening. The language of the reminder stood out to me. Recommended for people with a cervix ages 21 to 65. When I asked my OBGYN about the strange wording, she told me it was to be inclusive of their trans and gender fluid patients. I mean, yeah, like I think that the explicit intention of saying people with a cervix is to be inclusive of trans people. But also, if you are an OBGYN office sending out recommendations or reminders to get a cervical screening, it doesn't really make sense to just say any woman aged 21 to 65, because there are women aged 21 to 65 who have had hysterectomies who don't have a cervix. So it's not only for trans people, but it's also for the purpose of accuracy as to who actually needs access to medical care. You don't need a cervical screening if you don't have a cervix. Simple enough. It's always this need to center women in every aspect of this. Like, dude, it's just reproductive health care. Calm down. It has nothing to do with your personhood as a woman. Based on this response, so because of the wording of this for people with a cervix, this is what got her to decide to try to expose the medical scandal of gender-affirming care by saying and doing everything my daughter and other trans-identifying kids are taught to do. Okay, so this is a mom who has a trans kid who will not speak to her anymore. Like, she's one of those TERF moms who won't support her kid and is surprised why they don't want to talk to her at all. She continues, would there be the type of medical safeguarding and differential diagnosis we would expect in other fields of medicine? Or would I simply be allowed to self-diagnose and be offered the tools, hormones, and surgeries to choose my own gender adventure and become my true, authentic self? So basically, she's like, if I could lie, could I receive this medical care? So I want to be totally clear. This woman is admitting to insurance fraud. She's out here saying, I lied to these doctors to see if they would be covered by insurance as medically necessary care. Like, that is part of this conversation, is that I don't know that she actually ends up doing anything with that and like filling a prescription, but she's doing all of the steps involved with insurance fraud. If you're enjoying this video, hit the like button, maybe subscribe, hit all notifications if you want. Feel free to check out the links in the description. You might find some merch you like, or you can hit up the Patreon to support the content and find free stuff. Okay, she says, I wasn't prepared for how easy success would be. So this is a 53-year-old woman from California. Her kid has been identifying as a trans boy for a while. The kid wanted to start puberty blockers. The kid knew that they were safe because they had read the information saying that they're safe. The mom was super shocked. She felt like this announcement was sudden and unexpected. And so she's, I guess she's assuming that there's a rapid onset gender dysphoria thing. Like the implication that, oh, this is so sudden, it's just coming on out of nowhere. What would we expect from other forms of medical care? Is she a doctor? Does she know anything? Right, like when you go in and you have like, I don't know, knee pain, like do they spend time looking at your elbows? Like, I don't think so. So I don't know what the, if your problem is dissonance with your gender, what is the solution to that other than that? I guess it's just that they want there to be some kind of psychoanalysis as to why you feel that way so that they can assert that it's for some other reason and you shouldn't get health care. This person is basically opening with the idea that they're willing to lie just to make a point. It's crazy how she thinks she's credible. I know. Why do you think you have any credibility if you're just admitting to like, I did all of the steps up to insurance fraud? So this mom just gets so tripped up because they went to a doctor's visit, a regular doctor's visit. The pediatrician overheard the pronouns and then suggested that they could go to a different clinic to potentially learn about gender-affirming treatment. And this mom is like, oh my God, I'm freaking out. Like, a referral is exactly what a pediatrician is supposed to do. Like, I'm a general pediatrician. If you have gender-specific problems, you should go to a gender-specific specialist. Like, what a concept. That's actually, like, That is a rigorous diagnostic process. If a pediatrician says, I see that you need this care and I can't provide it to you, I'm going to refer you to someone who knows more and can help you more than I can. I think there are probably some pediatricians who are general pediatricians who would give that puberty blockers kind of care, but this one didn't. The simple fact is, you could have only gone to one doctor, but your kid has now been referred to a second doctor, which is at least one level of gatekeeping in the process. That's at least one level of you have to keep pursuing the care in order to get it. You have to go to a whole different clinic in order to get the medical care. Do they realize that self-reporting is part of the medical process and diagnosis, in all diagnosis, including cancer? Yeah, it's like you're saying, oh, my throat really hurts and I've got this weird lump. And then they're like, yeah, well, it sounds like you're kind of delusional though. Are you sure that you're not just imagining it? It's probably just allergies, which I say as a joke, but it's actually people die because of their symptoms being brushed off in exactly that same kind of way. So yeah, unfortunately, yeah, in that way, brushing off trans people's initial concerns and telling them to go find a therapist is exactly in line with a lot of other forms of healthcare where your concerns are dismissed because the doctor thinks they know better than you. Yeah, she's really like, oh, it's rapid onset gender dysphoria, which has been widely debunked. The ex-husband and her agreed not to consent to any medical care. So the kid decided to cut off contact when they were 17. And then, of course, the mom doubles down on being a TERF, as they do. So this is the point at which she decides to go undercover as a non-binary patient to show the kid that the kid might be putting themselves in danger. Oh no, these people are affirming you and they're not checking. Like, again, who do you think gets to tell a trans person? Like, what? Again, why do these people think that cisgender people get to assert themselves in a position of authority and tell trans people what's good for them? It is crazy to me that there are no trans people involved in the decision-making process of this whatsoever. So she's starting here. Throughout the whole 231-day process of my feigned gender transition, the Kaiser gender specialists were eager to serve me and give me what I wanted, which would all be covered by insurance as, quote, medically necessary. My emails were returned quickly, my appointments scheduled efficiently, and I never fell through the cracks. I was helped along every step of the way. Wow, you received like quality health care. You live in California, which is an extremely liberal state, and you had easy access to trans-related healthcare. Wow, it still took you almost a year. It still took her almost a year. How long did it take before the first time anyone suggested hormones or medical care to her? She did this for almost a year, just like lying to her doctors. Is it normal in other aspects of medical care that you'll just be ignored and your emails won't be answered? And is that really an indictment on trans care that it's so efficiently addressed, or is it more of an indictment on the rest of the medical system if what you're used to is having your appointments missed and falling through the cracks? Despite gender activists and clinicians constantly claiming that obtaining hormones and surgeries is a long and complex process with plenty of safety checks in place, I was in full control at every checkpoint. I was able to self-diagnose, determine how strong a dose of testosterone I received, and which surgeries I wanted to pursue, no matter how extreme and no matter how many glaring red flags I purposefully dropped. The medical workers I met repeatedly reminded me that they were not there to act as gatekeepers. Yeah, because again, like, this is just like, this whole process should be treated as equivalent to seeking plastic surgery, in the sense that as long as you don't seem like you're actively a crazy person, and even if in some situations you do seem like an actual crazy person, there are no like psychological tests you need to do in order to confirm that you're allowed to get a nose job, or that you're allowed to get a boob job, or that you're allowed to get a Brazilian butt lift. Why are we making trans people, like if a transgender woman wants to get a boob job, why does she have to go through all this additional gatekeeping where cisgender people tell her whether she's allowed to get the boob job? Whereas, you know, any 16-year-old girl can have their mom take them to get a boob job. Like, it's happened before, and it will continue to happen, teenage girls getting boob jobs for gender-affirming reasons. And it's really stupid that that people assume that there should be gatekeeping. Like, this woman is basically saying, you know, these doctors should have tried to stop me. Like, no, it's not the doctor's job to try to stop you. You're an adult. You are making an informed decision about your own body and your own appearance. As a 53-year-old person, these people expect you to be able to understand what you need and to be able to like make those decisions with informed consent. And like, so what are you complaining about? You're complaining that these people respected your bodily autonomy? That is what the complaint is. I was able to instantly change my medical records to reflect my new gender identity and pronouns. Despite not being diagnosed with gender dysphoria, I was able to obtain a prescription for testosterone and approval for a gender-affirming double mastectomy from my doctor. It only took me 3 more months, 90 days, to be approved for surgery to remove my uterus and have a fake penis constructed. Oh, cool. Yeah, therapy was never recommended. So again, this is insurance fraud, or is it not insurance fraud until you fill the prescription? She obtained a prescription, but I guess she didn't fill it. I really don't believe her. Like, I think that she is a liar when she says that she was approved for phalloplasty, because that's what she's saying. She's approved to have a penis constructed from a skin graft. I'm pretty sure that pretty much every insurance company requires you. Most insurance companies require you to already be on hormone therapy before they will give you top surgery. This is for a person who was assigned female at birth and is transitioning. A lot of insurance is resistant to covering your top surgery unless you've had hormones first. More insurances will not allow you to get a penis construction surgery unless you probably have both already been on hormones for a minimum of 1 year and have had top surgery. There is a gender norm being pushed on trans people through this insurance coverage thing, where if a person was assigned female at birth and they didn't particularly want to get rid of their chest, but they did want to have penis construction surgery, like a lot of insurances would not allow it. So yeah, like I genuinely think she is a liar, and I do not believe her when she says that she was approved less than a year from her first appointment getting insurance approval for a phalloplasty procedure. Girl, you are lying, and it's not cute. The therapy not recommended part is a little troubling. Therapy can be a good thing. I don't know why you would suggest therapy to a patient who seems coherent and with it and understands the informed consent aspect of unless you're going to suggest that therapy should be a requirement for all kinds of cosmetic procedure like this. When women want a nose job because they want to reduce their racialized appearance, do you think that they should be required to go to therapy that aims to get them to accept their racialized appearance? Because that's like the equivalent here of saying like a trans person should be required to go to therapy to what? To address what? Their feeling of wanting to change their body? That's the suggestion here. Like, therapy is great for people who actually have problems. Therapy works for people who have eating disorders. Therapy works for people who are depressed. But like, if you're taking a person who the only problem they're presenting is gender dysphoria, they're not presenting with depression, they're not presenting with anxiety. If you tell that person they need to go to therapy, what you're suggesting to them is that the thing of them being trans is a potential like a psychoanalytic problem that needs to be looked at and assessed before you can make that decision. I do think that therapy can help trans people a lot. And I think that if there is a hypothetical person who's just really stressed out by misogyny, that, therapy could probably help that person as well. And that there will occasionally be people who just really hate misogyny, and maybe they initially think that transitioning will help them. Like, in the number of things that exist in the universe, it's bound to happen at least a couple times that someone will regret earnestly their medical transition. Like, the suggestion that you should go to therapy should only come if it seems like you have some disruption in your life, that a totally healthy, well-adjusted adult can't seek transition care without being condescended to. Like, are you sure you are sure about this? Maybe you need to be psychoanalyzed by a cisgender person who can decide whether you're really trans or not. Like, are you for real? Therapy is for the things that are going to be comorbid with wanting trans healthcare that are, yeah. Like, you might want to deal with the oppression that you're living with and like losing your job because you're trans. Obviously, those kind of things a therapist is going to be able to help you work through. But a therapist can't resolve your gender dysphoria for you. They can only give you tools to help deal with your distress in the moment until you can get the actual healthcare that will resolve the issue that's causing you the distress in the first place. That's the point. Oh, so she actually addresses the point that I just made. Critics might dismiss my story as insignificant on the grounds that I am a 53-year-old woman with ample life experience who should be free to alter her body. However, this argument for adult bodily autonomy is a standard we apply to purely cosmetic procedures like breast implants, liposuction, and facelifts, not, quote, medically necessary and, quote, life-saving treatments covered by health insurance, or interventions that compromise health and introduce illness to an otherwise healthy body. The introduce illness to an otherwise healthy body is very funny to me. But yeah, she's like, it's different because I say it's different. Or like, what is she complaining about that these are covered by health insurance? Like that a cosmetic procedure is not covered by health insurance, but these are. I don't know what the problem is with that. Yeah, otherwise healthy body is a dog whistle, I think. It's different because the necessary and life-saving things should be harder to get. I guess that is kind of her. Yeah, she's sort of saying that these life-saving things should be harder to get and that like it's not good enough that she says she wants it, that health insurance should not cover it. I don't really understand what the point she is making. So she goes into detail on the story, a detailed timeline of events. On October 6th, she says that the label cis woman doesn't really reflect, and she wants non-binary to be put in her documentation. Voiced a desire to be put in touch with an endocrinologist to start testosterone treatment. So she requests a referral to an expert. A lot of regular doctors can give these prescriptions. Like, honestly, she took an extra step here. I frankly think it would have been more damning if she had asked her primary doctor to just give her the prescription, but she asks for a referral to go see a professional endocrinologist. Interesting. 15 minutes later, receives an email from another Kaiser doctor informing me that the medical records have been updated. It's like updating your address or your name. If you get married and you need to change your last name, like on your medical records, do you really need to bring in your driver's license? I don't know. And I guess they say here, yeah, once my primary doctor returned to the office, I'd be able to speak with her about hormone therapy. So the doctor is like, okay, I want to speak with you before I give you a referral. This is a normal amount of getting in touch with your doctor to ask for a referral for a more specific kind of healthcare. Charlotte says, if I had been denied a referral to an endo when I asked for it last year, I would be so upset. There's literally no reason to say no, right? Like, I just refuse to refer you. Like, what is the point? This lady responded the following day, thanking the doctor for changing the records and asking if she could connect me with someone who could help me make an appointment for top surgery because she's just lying. She says my chest binder was uncomfortable. So she's creating this narrative of she's claiming she's been wearing a binder and that she's doing sports and then it hurts her. And so she's asking about top surgery. It like, that's the equivalent of saying I have back pain from my big breasts and I want to have a referral for a consult for a medically necessary insurance covered breast reduction. That it's the same process, the same kind of reasoning. Like, it's like, why is she saying that she's literally a transgender? True. This doctor said to contact the primary care to get things rolling and that there were going to be preliminary evaluations. 6 days later, there was an email from Kaiser gender specialists asking me to schedule a phone appointment to understand the goals for surgery and get connected to care. This call to review my gender-affirming treatment options and services would take 15 to 20 minutes, after which I would be, quote, booked for intake, allowing me to proceed with medical transition. Again, this is a normal amount of communication. This wasn't an evaluation of whether surgical transition was appropriate. It was simply a meeting for me to tell them what I wanted so that they could provide it. But again, your problem is discomfort with a part of your body physically. That's what she claimed. She claimed that basically her boobs were getting in the way of her being able to do sports comfortably. Is there a situation where a doctor will say, I'm going to determine if a breast reduction is appropriate for you? It's based on the person's self-reported pain and discomfort. On October 18, there was the one and only in-person appointment in preparation for top surgery. I met with my primary care physician. There was a 10-minute physical exam, including blood tests. There was not a single question about why I wanted top surgery or cross-sex hormones. Who cares? You're 53. Nor was there any discussion of the risks involved with these medical treatments. Okay, well, that's definitely an oversight. Because, I mean, not necessarily a discussion of the risks per se, but a discussion of all of the effects. That's what informed consent means. So I would say informed consent is supposed to mean the doctor informs you of all the possible effects, positive and negative, and that you then can proceed knowing all the information. So I do believe in the process of seeking gender-affirming care, if someone is not notifying you, here are all of the risks, I think that that would be a major oversight. But again, I think this woman is a liar. Like, I don't actually know, like literally not like discussion of risks involved. That would have to mean necessarily that there were no discussion of any of the effects of the medicine. And also that means that in a discussion about surgery, there were no discussions of the risks of general anesthesia or surgery, which I think is insane and cannot be true. There's a good point of like, no one of sound mind would just lie about all of this to make a point. That is a foundational element of why these doctors went along with this. There's a presumption of good faith. If you're seeking medical care, I mean, for white people, there's a presumption of good faith for the most part, that you aren't doing this duplicitously, that you're not doing this just to be drug seeking or whatever. You know, certain people, and I'm sure that Beth is one of them, who is just believed for the most part right off the bat. The following week, there was a phone appointment with Rachel Wood, a gender specialist with Kaiser Sacramento. The call lasted 15 minutes, consisting of standard questions about drug use, domestic violence, guns in the house, and whether I experienced any suicidal thoughts. There were no questions from the gender specialist about my reasons for requesting a mastectomy or cross-sex hormones, or why I suddenly at 52 decided I was non-binary. Like, genuinely, she just really thinks that there should be someone paternalistically going, are you sure? Are you sure? Are you sure? Every 5 minutes throughout this process. That's genuinely what she seems to want. After the call, Kaiser emailed me instructions to prepare for my pre-surgery intake video appointment to evaluate my mental health, scheduled for the next month. The email stated that prior to my appointment, I should research hormone risks on the WPATH website and to quote, research bilateral mastectomy and chest reconstruction surgery risks and recovery on the website. So they provided you with the resources to understand all of the risks. They didn't cover all of the risks during your very limited in-person time at a clinic that probably has a lot of patients. So they were like, okay, we are providing you with the literature. This has happened to me before, where I ask about something at the doctor's office and they are like, okay, here's literature. You can read this on your own time and get an idea of how to deal with this. So this is another thing where it's like, okay, you want this procedure. Okay, cool. Thank you for asking for that information. Here's a pamphlet. Read it. And then you can understand the risks and decide whether you want to proceed. That's exactly what they're doing here. They've asked you the necessary mental health questions and they're going, okay, here's all the risks. You need to take the time to educate yourself. I can't sit here with you for an hour and go over all the different things. It's not realistic to demand that amount of in-office clinician time. Yeah, my mom asked me plenty of different versions of Are You Sure, along with plenty of other people in my life. Do not need more of that from medical professionals. So she decided to request a, quote, gender-affirming double mastectomy and phalloplasty. Kaiser sent me a sample timeline for transition surgery preparation, using as a reference for the process. I also asked for a prescription for testosterone as needed and recommended by Kaiser. So what is this? Sample timeline for surgery preparation. Okay, so this is just in the months leading up to your surgery, you know, here's how long it would take to get through this whole thing. Look at this. Mental health visit could take between 4 and 16 months. Nursing call with MSTRN could take 3 to 15 months. Surgery consultation could take 3 to 15 months. And then once your surgery date is scheduled, you have to quit nicotine for 3 months beforehand and all this other stuff. So this is like, this timeline is showing that it can take years, and it often does, frequently. There was a mental health visit conducted over Zoom, asking marital status, race, gender identity, other demographics, asked whether I was thinking of other surgeries. The lists she read included gender-affirming, hysterectomy, bottom surgery, vocal coaching, a lot of different stuff. And she asked if there's anything else that I'd be interested in. And this woman, again, lies and says she'd be interested in body contouring. I was also assured that all the procedures would be covered by insurance because they were considered medically necessary. How many trans people would kill to have Kaiser insurance good enough to consider all of our procedures medically necessary? I guess the one thing that she didn't offer her was face surgery. She says, I dropped in several red flags regarding my mental health to see the reaction, but they were all ignored. For instance, I revealed that I had PTSD. The therapist asked about whether I had experienced any childhood trauma. I mentioned that I grew up in Mexico City and had been groped by several times and also had people inappropriately expose themselves to me. So she drops this, just the general feeling that you are unsafe, in a female body. Basically, this woman is suggesting that a trans person or someone who thinks that they're trans might literally use instances of being sexually assaulted as the entire basis for wanting to change their entire body and have major surgical procedures done. Like, that is the suggestion. And like the idea that that the medical professional's job is to go, well, you might not really be trans because you just hate being a woman. Like, that is such a stupid thought process. Yeah, by the way, I have PTSD. This is me suggesting to you that I might not be trans. Like, okay, everyone who grows up in a female body feels this way, whether they're trans or not. The feeling of being unsafe, okay, but most women don't try to change their entire body because they're women and they don't want to have hairy testosterone bodies. Only trans people typically do. Instead of viewing this trauma as potentially driving my desire to escape my female body through hormones and surgery, she asked whether there is anything, quote, important that the surgery team should be aware of regarding my history of trauma, such as whether I'd be comfortable with the surgeon examining and marking my chest prior to surgery. Those are the kind of concerns that would matter. That's the kind of concern that would matter, is going, hey, okay, well, if you were groped when you were younger, then is there anything we need to know about, because we're going to be drawing on your naked chest with a marker. Those are the only things that you would need to ask about. Also, I think that it's probably worth pointing out that, yeah, okay, so a 20-year-old female might pursue hormone therapy because they don't like being groped and seen in this way. But a 53-year-old woman is not feeling unsafe the way that a younger woman does. You're not getting groped. I almost guarantee that a 53-year-old woman with this much hate in her heart is not attractive enough to be getting hit on or catcalled or groped in public. So there would be no reason for you to seek an escape from your female body being tortured by all this male attention if you're 53. Like, clearly that would not be an active part of the problem. When asked about any psychotic symptoms, I told her that while I had no such symptoms, my mother had a delusional breakdown because of body dysmorphia, with a growth on her neck that she thought needed to be removed. I told her that my mother was admitted to an inpatient hospital for depression. I asked the doctor whether she sees patients with body dysmorphia and whether I could have potentially inherited that from my mother. She said that psychosis was hereditary, but that it was highly unlikely that there was any connection between body dysmorphia and gender dysphoria. She told you the factual, scientific, medical information. Body dysmorphia is a different disorder. Gender dysphoria is a different disorder. Sometimes, very occasionally, people might have both, but gender dysphoria is considered a distinct diagnosis because it's not the same thing as body dysmorphia. Like, so yeah, this doctor, you brought up a concern. You said, hey, my mom has this disorder. Is it possible that I have it too? And it's like, probably not, because you have not described any of the symptoms of that. All the lying you've been doing, you've been lying about having symptoms of gender dysphoria. If you wanted to make it seem like you might also have dysmorphia instead or whatever, then you would have needed to lie differently. I was enthusiastically waving more mental health red flags, waiting to see if she would pick up on any of them. She says, I'm just wondering if my feelings or perseverating, what the f does that mean? Or feeling like these breasts make me really unhappy and I just don't want them anymore. I'm just not sure if that's a similar feeling to body dysmorphia. How do you decide which one is dysphoria and general body dysmorphia versus just not liking something about your body? I did have an eating disorder through college. I was a distance runner in college, so I had bulimia and anorexia. I don't know if that's related to gender dysphoria. The therapist replied, I completely appreciate your concerns, but I am going to ask you questions about your chest, about your expectations, and then I'll be able to give you an assessment. She said the main difference between my mom's situation and mine was that my mom didn't actually have a growth on her neck, whereas it's confirmed that you actually have chest tissue. Yeah, that's the whole thing. Body dysmorphia is you imagining that there is a problem that there isn't, whereas dysphoria is having a problem that is there. Furthermore, she said that while, quote, historically there's been all this pressure on patients to be like, are you really, really sure you want hormones? We are a little bit more relaxed now. As long as you are aware of the risks and the side effects, you can put your toe in the water. You can stop testosterone and you can go back on it and do it again later. You can stop it. You know what I mean? So she's literally saying you don't have to get on hormones and then permanently stay on hormones. It's okay for you to do it briefly and try it and then decide that it's not for you. It's not going to harm you medically to do that, which is true. You can try hormones for a short period of time. We ran out of time on that meeting, so I scheduled a follow-up meeting. Here's another one. This professional says she regrets the gatekeeping vibe of the meeting. She asked what I've been looking into. This woman lied and said she was interested in taking small doses of testosterone. to get a feeling that's kind of neutral. Yeah, I mean, lots of trans people want that. Now she's dropped more red flags. I don't own a single dress or skirt and haven't in 20 years. I think for me, it's just dressing the way that's comfortable for me, which is just wearing jeans and sweatshirts and flannel shirts and boots. So I think it's been nice being able to dress, especially because I work from home now most of the time, that just a feeling of clothing being one of the ways I can feel more non-binary in my everyday life. Why does she think that's a red flag? It's literally true that a lot of trans people realized how much more comfortable they could be with themselves when they didn't have to go outside anymore. Like when you work from home, and then like I realized as a trans person that I don't want top surgery. I was assigned female at birth, and I don't want top surgery because I like my body in isolation. It's only when other people look at my body and treat me like I'm female and like stare at my chest, like those are the things that make me uncomfortable. So being at home made me in fact realize that I did not need one of the transition things that is like there's pressure on me to make my body more normative. All of this makes sense. This is not a red flag. Just saying I like to wear what I want to wear and I feel more comfortable not having to perform femininity now. And again, she's lying about all this, saying I don't feel pressured to dress feminine. I feel more comfortable that I get to be non-binary at home. Like, okay, congrats. Yes. Like you've just learned what to say in order to get this care. Again, if someone is lying this hard in order to get the care, like it seems like you really desperately need it, or you're being a bad faith, I'm trying to expose this kind of person. So because this doctor then accepted what she said is true, this doctor asks me to describe my dysphoria. I told her I didn't like the feeling of the female form and being chesty, and that because I'm going through menopause, I wanted to start taking testosterone to avoid, quote, that feeling of being this apple-shaped older woman. Okay, again, like I think these are all totally normal requests for a trans person to have. She says top surgery, not testosterone, would be able to solve my chest dysphoria. She told me that we had to go through a few more questions related to my medical history before we can move on to the fun stuff, which is testosterone and top surgery. I think this woman just genuinely hates that there's any positivity around this at all. She just genuinely hates that there's any like nice people who want to help trans people get the care that they want. There was a discussion of the physical and mood changes I could expect, asking about the dose of testosterone and what kind of top surgery technique I would want. All of these consultations would be virtual. Okay, that's good. That's preferable. The gender specialist told me that after the appointment, she would need to submit my referral to the multi-specialty transitions clinic team that oversees this care. There would be a follow-up nursing call reviewing the medical history, and then they would be able to schedule a consult for a surgeon. I just want to point out again that this has so far been a months-long process. Okay, so you have some goals. You can decide flatness, nipple sensation, scarring, and that'll help you figure out what kind of surgery you want. January, I had my nursing call with the nurse coordinator. Potential allergies, recreational drug use, verified I'm up to date on mammograms, pap smears, and colon cancer screenings, as well as vaccines. There's a top surgery class available for patients where one of the Kaiser surgeons, quotes, presents and talks about surgical techniques and options within top surgery. Also, sometimes this class is required because Chloe Cole said that her family was required to go to a class going over all of these different things. Like, this is so much gatekeeping. If you require a top surgery class, and in this case, it's not required, but if you do require it, that's the equivalent of like requiring a woman to listen to the heartbeat before you'll give her an abortion. Also, this is extremely good insurance. Kaiser, and for this to be going as fast as it is and for it to be all covered, like she is paying some fat stacks for this insurance every month. And then they sent the referral, and then they would have to schedule a consultation. This is so many doctor's appointments, by the way. This is so many doctor's appointments. Like genuinely, I guess maybe it's different when you want insurance to cover it, but a lot of the time, if you go the informed consent route and you go to Planned Parenthood, they will just give you a prescription the first day that they see you. But this woman made her initial appointment, like she emailed her doctor in September. Now it's at the beginning of September. Now it's the end of January, and she's having her first appointment to discuss where she could have just gotten it from a Planned Parenthood. Like, so again, if you're trying to blow the lid on, oh, it's way too easy to get this care, you are not demonstrating that right now. They start asking, what do you like to do? What kind of physical changes are you looking for? She says, I want facial hair and to change my physique to feel stronger and androgynous. She asked if I was menopausal, whether I had ovaries and a uterus. The doctor said she wanted me to come in and get some labs so she could test my current levels. Honestly, my main doctor doesn't necessarily require estrogen and testosterone to be checked before you start. Like, I could understand, I guess, why an older woman would have these tests done. And of course, hemoglobin levels. So 5 months later, in February, after starting this process in September, you got a pump of testosterone. Oh, she did pay for it. She committed insurance fraud, guys. She paid a $5 copay at the Kaiser Pharmacy and picked up a pump of testosterone. Dude, she actually committed insurance fraud. Like, all the way up to this moment, I don't think that I would consider, like, I don't know, I'm not a legal expert. I don't think I would consider doing these appointments to be insurance fraud, although it is like a waste of the insurer's time and money and a waste of the doctor's time and money. But filling the prescription for me puts it over the edge. That's 100%. You just committed insurance fraud and you are telling everybody about it, as far as I know, under your real actual name. Committing insurance fraud to own the libs. To them, it too easy is whether they can get trans healthcare at all. Like, yeah, if you can access it at all without having to do 3 years of rigorous therapy, that's too easy. The same day I got my labs, I had a Zoom surgery consult for the surgery. This consultation was discussing my goals for surgery, not about whether surgery was needed or appropriate. You are well past the point that anyone could or should be asking you whether surgery is needed or appropriate. It doesn't matter. Like, you don't need your it's not like going in and being like, hey, I would like to have my kidneys removed. People are going to be like, wait, you need those. You don't need your breasts. So it's maybe not as rigorous of a medical, oh my God, I can't even think of the words right now. She says that she wants a flatter androgynous appearance. And then we're talking about some of the different options, thoughts about keeping your nipples, because sometimes that's not covered by insurance. She asked if I would like the placement of the nipples to resemble a more male appearance. Okay, these are normal. Isn't goals with surgery sort of inclusive of is surgery needed or appropriate? In this instance, I think that she's trying to suggest that there could be some kind of psychological reason why the surgery is inappropriate. To the person giving her these assessments, like, goals of surgery means like, what do you want out of this? Which is going to tell us what sort of procedure we need to do. So at this point in the process, discussing your goals with surgery, I don't think to the clinician is going to have anything to do with whether the surgery is needed or appropriate, because someone else behind her, like someone else in this process, already said, I've talked about like whether surgery is appropriate with this patient. By the time you're speaking to the plastic surgeon, you would not be having a conversation about whether you really need the surgery or not, or whether it's even appropriate for you to get the surgery. Like, in this instance, we're just talking about, where do you want your nipples placed? Do you want it to look like you have pecs? Do you want your chest to appear masculine, or do you want it to be more neutral androgynous? You know, I was asked to show my bare chest from the front and side. She asked about whether it was important for me to keep nipple sensation. This is like a normal consult. She told me I was a good candidate for surgery and put me on the surgery wait list. She said the wait time was between 3 and 5 months, but a cancellation could move me up to a sooner date. That is fairly quick, but I think it's just because, again, she lives in California and there are a lot of providers who provide this there. Also, if I wanted surgery as soon as possible, I could tell the surgery scheduler that I'd be willing to have any of the other 3 surgeons perform my mastectomy. California, true. They contacted twice in February and March, notifying me of cancellations. If I had accepted and shown up on those dates, they would have removed my breasts. This would have been less than 5 months from the time I first contacted Kaiser to inform them of my new, quote, non-binary gender identity. Listen, you pay for premium healthcare. No trans people can afford this shit unless they're Caitlyn Jenner. Most people cannot afford this level of fast-tracked care. This is very specifically, and I live in California and I pay big bucks for good insurance kind of thing. Yeah, wow, waiting an entire half a year for a doctor to approve you for getting a thing that you know that you need. I decided to see how easy it would be for me to get approved for a phalloplasty, sending an email on March 1st, requesting a phalloplasty and concurrent hysterectomy scheduled alongside my mastectomy. Are you serious? Hold on. Is she really saying I want to get a concurrent phalloplasty and hysterectomy? Most people don't do that. That's 2 pretty intense surgeries to have at the same time. You want to space them out a little bit. I explained to the specialist that I wasn't sure about taking testosterone anymore because I already had quite athletic and muscular build. Taking T didn't make sense for me. I wanted bottom surgery. I told her that I wanted to schedule top and bottom surgery concurrently so that I wouldn't have to take more time off work. Okay, I will say that if a surgeon agrees to do top surgery and bottom surgery on you at the same time, that is a red flag. I'm going to just go ahead and say that that's a red flag. But okay, and then she had a consultation, got an email, they've received the referral and they're working on scheduling. Final thoughts. In fewer than 300 days, based on a set of superficial and shifting thoughts about my gender and my quote embodiment goals. Oh my gosh. This sentence really, okay, I just want to point out, here's where this sentence starts. This is one paragraph, all one sentence. There are no periods in this whole chunk of, wow, I'm not even going to read that run-on sentence, girl. Learn how to right. No other medical field operates with this level of carelessness and disregard for patient health and welfare. Oh, do you mean even the ones who give women nose jobs? Like, you think that the people who have nose jobs and have like a 40% regret rate, no other medical field operates with this level of carelessness. She writes this as though it's scaremongering. Like, oh wow, look at how easy it is to get this care. But how much was your copay for every single one of those visits? Do you think trans people can afford like multiple doctor's visits a month? Literally, there are trans people who have to wait for consultations because they cannot afford the consultant fee. There are so many trans people who have shitty insurance or no insurance. Like, why don't you try to go the no insurance route? Why don't you pretend like you only have $50 spare money every month? This is a wild outlier in terms of easy, quick access to hormones and surgery. So yeah, I guess TLDR, transphobe commits insurance fraud to own the transes. Like, yeah. Like, this woman just straight up committed insurance fraud in order to show how this industry is too easy to get healthcare through, not understanding how extremely skewed her version is by being wealthy enough to afford really good insurance that happens to, like, apparently not consider trans care to be cosmetic. You live in California, where a ton of these surgeons are. She can never walk a mile in a poor person's shoes, let alone seek trans care and be broke. I don't understand the purpose of this. It's really just scaremongering. Like, this woman believes in the rapid onset gender dysphoria myth, and she thinks that being sexually assaulted when you were younger means that you shouldn't be allowed to get gender-affirming care, basically. This TERF is so rich and privileged that she has no idea what the majority of Americans have to deal with concerning ordinary healthcare, let alone trans healthcare. Yeah, it's super out of touch. Much love to my patrons, especially Tiago Nascimento, Mersh Rolvog, Michelle Frateroli, Amanda B., Wellington Marcus, Michelle Winter, Danielle McDonald, DZXN, Suzanne Maynard, Spooky Heather Sylvia, Jamie Jam, Pasnell Infinity, Nova, Sojo, Elizabeth Bartell, Ella V. Nobody, Kevin Young, Sarah A., Athiet, Celeste, Desi Quiche, Liam Hodgson, and Mr. Atheist.